I'm Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and I want to thank you for choosing us for Botox. A little bit about me, I've been doing Botox for a little over 11 years now. I'm an Allergan Medical Institute trainer, which means I train other physicians, nurses, how to do Botox and of course filler. So what I wanted to do today is just explain to you a little bit about Botox, how it works, where we use it, how long it's going to last. So I have this little face here, and the FDA has approved 3 areas for Botox. The first is the glabella region, which would be your angry eyes, your 11s. The second region are your crow's feet, and the third is your frontalis muscle or your forehead. So the glabella region, what happens is these 2 muscles squeeze together and create the lines going down, or like I said, the 11s are your angry eyes. So what we want to do is we want to relax these muscles plus this muscle. And this little muscle is actually lifts up and creates the line going across your nose. So when we inject in the glabella region, we want to inject here, 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 and here. So you have 5 little injection points. And what that does is it relaxes this area. So as you can see, this is where the muscles insert. And so it's going to relax the whole area, and you'll actually have a little bit of resolution of lines on your forehead. Now, the FDA has approved 20 units for that area. My average patient's probably 24, 25 units, and it really just depends on your age, how deep your lines are, and really how many lines you do have. So that area is probably the most common area that we treat. The second area is probably going to be the crow's feet. So the crow's feet are these little lines that come out this way. It's your smile lines, and we want to relax those just a little bit. And what happens with that is there are actually 2 different ways you can inject this, and we go according to where your lines are. So we'd go 1, 2, 3, or 1, 2, 3, and same thing over here, 1, 2, 3. Now, I say there are only 2 ways to inject it, but technically, let's say that you're doing this for prevention. You might only have 2 injection points on each side, and if you really don't have many lines, except for maybe on the corners of the eyes, maybe we only inject right there. So think of Botox as prevention, but it also is correction. So the FDA has approved 24 units in there, and I would say that's probably average in our clinic. Now, the last area that the FDA approved is our frontalis muscle. So that's this muscle right here, your forehead. So if you think about it, your lines go directly across that forehead. So what's happening is that frontalis muscle is actually tightening up and lifting up your eyebrows. So it's always sort of a miscommunication. Like, people think that by injecting here, you're gonna get an eyebrow lift, but that's not the case. Injecting here is gonna give you the eyebrow lift. This area actually relaxes the eyebrows. So you don't wanna go overboard here. I always say less is more. So what I like to do is we talk about all the different areas, we figure out what your budget is, we inject what I feel is appropriate, we have you come back at 2 weeks. So I'll get back to that in just a second. So the FDA has actually approved 20 units on the forehead. I typically will stay between 10 and 14 units, and I see nice results with that. The only thing with doing a little less than the 20 is that you probably aren't gonna last the 3 months as most Botox will. So if you think about it, 20 units in the glabella, 20 units up here, but we're gonna go a little less, and then 24 units here, you really should get 3 to 4 months out of that. But if we cut this in half and we're only doing 10 to 12 units, you're probably only gonna get about 6 to 8 weeks out of it. So with Botox, what it does is it relaxes the muscle, so you can't make the movement. So again, as I said, it's prevention. So I don't have any lines. I've been doing Botox for over 11 years. I didn't have any lines to begin with, so I do a little bit less than what my average patient is. And mine right now, like I said, after 11 years, it's lasting definitely 3 months. Sometimes I can even get 4 months out of it. Now, my forehead, I only do anywhere from probably 12, maybe 14, because I'll add a little bit here and here for a little lateral eyebrow lift. I really only get 6 to 8 weeks out of that. So think about the more you put in, the longer it's going to last. But obviously we don't want to overdo it. So Botox is a beautiful treatment because everyone will notice something like, did you get your hair cut? Did you lose weight? You look rested, something like that. But nobody should know you had Botox. Same with filler, but we're just talking Botox today. So Botox doesn't kick in right away. So I always tell everybody, don't expect miracles tonight. It can take up to 2 weeks to kick in, where the average person is about 3 to 5 days. Mine takes anywhere, 7 to 10 days probably. So 2 weeks is the max amount of Botox. That's when we want to see you back, because that's when we know that the results have kicked in. When you come back at that 2-week visit, we may add a little bit more. It's not going to be another 20 units in the glabella or anything like that. Maybe 4 units, maybe 6 units, something like that. So if everything looks great and you're not having any movement when you come back at your 2-week follow-up, then we wait and see how long your Botox lasts. If it only lasts 2 months, well, we probably need to add a little bit more at that 3-month visit. So Botox is super simple. It really doesn't hurt. Everybody thinks that it's gonna hurt, and so the anxiety of the first time is a little bit scary, but 99.9% of my patients say after we treat you the first time, that was it. Well, that was nothing. So don't be afraid of Botox. I mean, I personally don't love needles. I don't mind injecting, but I don't like getting them. And I honestly won't go without my Botox. So if you have any questions, we will see you at your consultation. Thank you.